Hello and welcome to our video series for SmartCBT. In this episode, we will provide a general introduction to anxiety, symptoms associated with it, and the science and biological reasons behind anxiety. Anxiety disorders can also often lead to depression. The NHS explains that anxiety is a feeling of unease, such as worry or fear, which can vary from mild to severe. Everybody can experience feelings of anxiety. For example, you may feel worried and anxious about having a job interview or sitting an exam. Feeling anxious during times like these is perfectly normal. However, some people may find it difficult to control their worries, and their feelings of anxiety are more constant, which can affect their daily lives. The anxiety and worry are associated with 3 or more of the following symptoms: restlessness and feeling on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. The anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributed to the effects of a substance, such as drug abuse or abuse of medication or another medical condition. Other specific anxiety disorders include panic disorder with or without agoraphobia, social anxiety disorder, phobias, including specific phobias which centre around a particular object, animal, situation or activity, and complex phobias, often associated with a deep-rooted fear about a particular situation or circumstance. Obsessive-compulsive disorder, or OCD, health anxiety, post-traumatic stress disorder, or PTSD, and body dysmorphic disorder, or BDD. Panic disorder results in regular panic attacks, which may not have a specific trigger and can feel like they are out of the blue. Symptoms can include an overwhelming sense of dread or fear, chest pain, or a sensation that your heart is beating irregularly. The main diagnostic feature is the catastrophic misinterpretation of a body sensation as a sign of physical or mental health threat or death, and can occur with or without agoraphobia, which is the fear of being in situations where escape may be difficult or help won't be available if needed. Social anxiety disorder, also known as social phobia, is the intense fear or dread of social or performance situations, the fear of social negative judgment which can happen before, during or after the event. Some common symptoms may include sweating, a fast heartbeat, shaking voice, or blushing. Phobias are an overwhelming fear of an object, situation, place, feeling, or animal, leading to avoidance and an impact of life or functioning. Phobias develop when an individual has increased feelings of danger about the situations or object. Common symptoms of phobias include arranging their daily routine to avoid the phobia, which is causing the anxiety. Common specific phobias may include height, animals, confined spaces, blood or injury phobia, and vomit phobia. Agoraphobia, or fear of the marketplace, is the fear of being in situations in which escape may be difficult or situations in which help won't be available if they are needed. This can include leaving your house, public spaces, public transport, and being in crowded places. Symptoms can include distress, panic, anxiousness, and avoidance to situations. OCD is when you have obsessions, compulsions, separately or both. An obsession is something you keep thinking about, and this can be difficult to ignore and can be disturbing thoughts, leaving you feeling distressed or anxious. A compulsion is something you think about or may do repeatedly to relieve the anxiety and get rid of the thought. Symptoms include intrusions, thinking something bad will happen if you do not do the things, realising the thinking and behaviour is not logical but finding it very difficult to stop, There are also different types of OCD, which include contamination, checking, intrusive thoughts, reassurance seeking, ruminating, rituals, routines, and hoarding. OCD can be about harm and relationships. Common appraisals of intrusions include I am in danger, I am dangerous, I am mad, or I am bad. Post-traumatic stress disorder, or PTSD, is when your anxiety symptoms were caused by a life-threatening situation or an overwhelming event. You may feel anxious for months or years after the event, even if you were not physically harmed at the time. For more information about PTSD, please see our episode Trauma, which is dedicated to trauma and PTSD. Body dysmorphic disorder, or BDD, is when you have upsetting thoughts about the way you look and these do not go away. These thoughts will have a big effect on your daily life if you have BDD. This is not the same as being vain about your appearance, and you may believe that everyone around you perceives you as ugly, even if they reassure you that this isn't true. Symptoms can include staring at your face or body in the mirror, comparing your features with others, wearing lots of makeup, or thinking about surgery. There is often multiple ways of checking and seeking reassurances. More specific details on each type of anxiety disorder will be featured in future episodes. So, what actually is anxiety then? Well, biologically, anxiety is meant to put us in a heightened state of awareness so we're prepared for potential threats. Anxiety is a physiological state characterised by cognitive, somatic, emotional and behavioural components. These combine to create feelings that we typically recognise as fear, apprehension or worry. During a state of anxiety, this is what happens to us. Somatically, the body prepares us to deal with the threat, also known as an emergency reaction. Our blood pressure and heart rate increases, sweating increases, blood flow to the major muscle groups is increased, and our immune and digestive functions are inhibited. Externally, somatic signs of anxiety can be recognised by pale skin, sweating, trembling, and dilated pupils. Emotionally, anxiety causes a sense of dread or panic. This can cause physical responses such as nausea and chills. Behaviourally, both voluntary and involuntary behaviours may arise which are directed at avoiding or escaping the source of anxiety and often maladaptive. This is most extreme in anxiety disorders. However, anxiety is not always maladaptive or pathological. It is a common emotion with anger, fear, happiness and sadness, and has a very important function in relation to survival and in our fight, flight or freeze responses. Anxiety is a normal and natural part of being human. There are going to be times where we are more nervous and worried than others. When these fight, flight and freeze responses never turn off, this is when the issues of anxiety arise and begin to cause trouble. The feeling of anxiety is part of our body's stress response. This fight, flight or freeze response is triggered and our systems are flooded with cortisol and norepinephrine, both designed to boost perception, reflexes and speed in dangerous situations. These increase heart rate, get more blood to your muscles, get more air to your lungs and get you ready to deal with the threat. Your body turns its attention to survival, even when it does not need to. Scientists have discovered that the part of our brains which play significant roles in anxiety disorders are the amygdala and hippocampus. The amygdala is an almond-shaped structure deep within the brain which communicates part of the brain that processes incoming sensory signals and the parts that interpret these signals. It alerts the rest of the brain that a threat is present and can trigger a fear or anxiety response. The hippocampus is the part of our brain that encodes threatening events into memories. Research has shown that the hippocampus tends to be smaller in some individuals who are victims of child abuse or military combat. The hippocampus plays a role in flashbacks, deficits in memories, and fragmented memories of the traumatic event. Treatment of anxiety depends on the nature of the anxiety disorder and individual preference. Often, treatment is a combination of types of therapy and medication. Some self-treatment recommended for anxiety includes stress management, relaxation techniques, exercises to replace negative thoughts with neutral balanced thoughts, having a support network, and physical exercise. Therapy treatment of anxiety may include psychotherapy, such as cognitive behavioural therapy or CBT. CBT aims to recognise the thought patterns which trigger the anxiety disorder and feelings, and CBT limits the distorted thinking and changes the intensity of reactions to stressors. CBT helps people manage the way their body and mind react to certain triggers. Several types of medication can also support the treatment of anxiety disorders. Although anxious feelings may be present in everyday life, for someone with an anxiety disorder, there are also ways to reduce the risk of present symptoms. These include reduced caffeine, tea, fizzy drinks and chocolate consumption, a balanced diet, regular sleep patterns, and avoiding alcohol, cannabis or other recreational drugs. To conclude, treating anxiety disorder focuses on psychological therapy, medication, lifestyle adjustments, and treatment will be different for each person depending on the type of anxiety disorder and whether there are any underlying conditions. Thank you for watching this episode to a general introduction to anxiety. We hope this has informed you about the biological influences on anxiety and symptoms associated with it. Stay tuned for more future episodes. Thank you and see you next time.